So one of the other major problems that came up early on in the pandemic was care rationing, and recognizing that hospitals were filling up and that hospitals themselves were worried about what would they do if they couldn't treat everyone. How would they decide who to treat when? And so hospitals and states were coming up with guidelines about crisis care. And major coalitions came together of disabled groups, senior advocates, and higher weight people to fight against policies that would propose to determine which lives to save based on the number of years people had left, or even worse, what's called quality adjusted life years. And this is an idea that is very outdated, and a lot of people recognize that, but certainly not everyone does, where the idea of the quality of someone's life is decided by people who are not disabled and who are not older. And this tremendous assumption that if you have, any number of disabilities, that your life isn't as good. And so if that decision must be made, better to sacrifice you than a young non-disabled person. And again, recognizing that disability is, disability comes up disproportionately in communities of color, in immigrant communities, in poor communities. These policies were not only ableist and ageist, but they were also very clearly racist and classist, and brought in every other kind of oppression.